Okay, now we're going to talk about dental health. Now, one of the things when we're looking at dental health, hello, perfect one. When we do a thermography, and this is why we look at it, because if you've had extractions where they pulled a tooth, if you've had implants, if you've had root canals, if you've had any type of dental procedure, we could see a hot spot on the thermography. Now, lymph for the drainage for the face, mouth, and lungs drains to the right chest area. So on a thermography, if we see hot spots here, we know it's either lung or dental. If we see a hot spot here, it's going to be more than likely dental. It could be sinuses. If we see a hot spot on the left chest, it's more of a gut issue. So everybody is going to have a problem with a dental implant. Everybody's going to have a problem with a root canal. Everybody's going to have a problem with an extraction if it wasn't done correctly. So how do you know if it's an issue? You got to do a thermography. Okay, so now let's regenerate the gums. So this means gingivitis is going to go away. We're going to regenerate the enamel. So this means cavities can actually heal themselves. Okay, I know. Go. That sounds so cool. Okay, so let's go over dental health. Now, number one thing, they used to use the thing called amalgam, which is a mercury and combination of heavy metals. And it was really neat because it had a cool melting point. You could pour it in the tooth, fantastic. Worked really well. Except it's neurotoxic. It's poisonous to the brain, central nervous system. It's not good. Gold also has some heavy metal. And the silver fillings also have heavy metal. So these are too dangerous. If you have to have cavity filled, biocompatible resins are the closest, but you're always, anytime you have a foreign object, there's always going to be a rejection factor. Implants are always going to have a negative. That's why Hal Huggins, who developed this certain protocol years ago, back in the 70s, said implants are dangerous because anytime you have a foreign object, the body can respond in the negative. It wants to get rid of it. This is why we had a patient here who hadn't seen us in like a year and a half. She was talked into getting 2 knee replacements. And it's been 6 or 7 months, and she's still walking like this, or, it's just miserable. She can't get out of a chair. I'm not a fan of implants. Okay, and if you can get away without it, fantastic. Now, root canals. Sometimes a root canal is going to be absolutely vital. Temporarily. Okay, it can prevent, like, you can do bridges. It's hard to deal with dentures. So a root canal may be okay temporarily, but you have to monitor it with the thermography because having dead tissue in your mouth can affect your whole body. Like, everyone in here has heard of reflexology. There's certain points on the feet that affect certain organ systems. We know acupressure, acupuncture, certain parts of the body affect certain organs. Same thing with the mouth. There's dental toxicities affect the whole system. So this is why when we do a full body thermography, and we're going to have one here eventually and then at our clinics for sure. So if you have anything like this, it's hugely important. So let's go over how to fix this. Now, number one thing, if anyone's ever had an extraction, normally, when you go to a dentist, they'll pull a tooth and give you a pain reliever. That can leave the ligament in place and create a subclinical infection called a cavitation. And dentists aren't trained to find it, to look at it, or to prevent it. So the way an extraction has to be done is a tooth is pulled, then they have to go back in, a totally different operation to remove the ligament. Then they have to take the patient's blood, spin it down the plasma cell, and inject the opening so the bone regenerates. Then you treat that with ozone, and that whole process is done with a vitamin C IV. That's the best in the world. That's the Huggins protocol. And that's what we have at our clinic in Mexico. But if you need any dental work, find a Huggins protocol dentist. Now, let's work on gum regeneration. Now, if you brush your teeth and there's blood when you spit, or there's blood on the toothbrush, it means the gums aren't healthy. It usually has to do with viruses or bacteria or funguses or mold. So let's get it healthy. Now, number one is diet. high dose vitamin C. We already saw beautiful blood coming out because you guys are either taking some vitamin C or drinking water, and great job. You guys had really good blood changes. Okay, diet's huge. Then brush the gums. And this doesn't mean, well, I don't want to brush them too much because they're weak. No, get a medium or firm brush, and I mean brush them like they're teeth. Because if you want to build your muscles, you don't lift paper. Okay, you put it under a strain. If you want calluses, if you want good thick skin, because you're going to grab a rope, what do? You work that rope. Same thing with the tissue. You brush the gums like they were teeth. And the first few times it may start to bleed a little bit because you're working tissue and that hasn't been worked before. But you're literally going to see gums regenerate, and no fluoride in the toothpaste. The best is going to be baking soda, like we make our own toothpaste, a baking soda and essential oils. Coconut oil is a great toothpaste if you can find it. The only place I found it around here is in Hua Hin, and I'm just intimidated. If you go to like some of the big stores where there's toothpaste, there's literally 10 meters by 10 meters of toothpaste. I still haven't found a good coconut fat-based toothpaste, but no fluoride in the toothpaste. It's damaging to the brain. Now, enamel regeneration. This is how to reverse cavities. What you want to do, and when you were in school, did you ever make the volcano where you put baking soda and vinegar and then it went like that? Well, that's what we're going to do with the teeth, because underneath the gums, in between the teeth, brushing the gums will help clean that area. But also, let's do some chemicals. So if you take baking soda, and it's got to be aluminum-free baking soda, you want to brush and fill all the cavities around your teeth, okay? And don't rinse your mouth. Then get some apple cider vinegar and then rinse your mouth. And you're going to see it's going to explode. It breaks up all the plaquing in between. It just breaks everything. And if the gums are receding, you have sensitive teeth in there because the nerves are going to be more exposed. So this is powerful to get rid of the plaquing, but it may make the teeth really sensitive. It's okay because we're going to regenerate the enamel. Then, after it all bubbles and foams up, then rinse it with water. Then you need essential oils. There is an essential oil expert here in the back row. doTERRA is a good brand, okay. But then what you want to do is coat the teeth. See, you've got a tooth, and on the outside of the tooth is enamel. Enamel can be regenerated, okay, but that it's generated from the dentine, which is the meaty part of the tooth on the inside. Now, the essential oils actually pierce the enamel and get into the dentine to produce healthy enamel. So this means cavities can go away. So when you do this, you brush with a baking soda, rinse with the apple cider vinegar, allow it to explode out of your mouth, rinse it with water, and then coat the teeth with essential oils. Now, I would recommend doing this, brushing the gums, if you have really bad teeth, okay, or teeth that haven't had a lot of care. Do this once a week, for a month. And then see, because you're going to see the gums are going to start to bleed a lot when you first do this, and they're going to bleed less and less and less. And you'll start to see, instead of the teeth being sensitive because the gums are receding, the gums are literally going to build up. And you literally can reverse, you're going to get enamel growth, but you can reverse cavities and everything else. Does that make sense? Okay, any questions about all this stuff? Excellent choice. Which essential oil? I don't know. This is the greatest doctor is inside of you. And I know I've said this a whole bunch because I want you to be confident in yourself. Smell it and check it. Most people will find peppermint, spearmint are going to be really, really good, okay, because they like that smell and that taste. And so if you like that smell, it means your body's going to accept it. Yeah, so peppermint, spearmint, look at the ones that flavor. Some people like pine, okay, but all the essential oils have antioxidants and they pierce it. Some of the more strong ones like frankincense, myrrh, those are going to be more good, better for skin issues. You know, there's a lot, but all of the essential oils have antioxidants. Any other questions? Yes? Yeah. Yeah. Is it a problem or not? The only way to tell is to get a thermography. That's the only way. Because you can't, when we talk about cavitations, and this is if you've had an extraction that wasn't done correctly, if there's a root canal that's in there, you know, because I mean, when I was hit by the car, I had my front tooth knocked out. And so now I've had both of these ground down and a bridge going across. So is that going to be an issue for me in the future? Possibly. Okay, but that's why I do thermography to check it. So you do a thermography to see if there's a hot spot here. And if it could just be local that you brushed your teeth and it's bleeding a little bit, but if we see a hot spot on the right side of chest, because that's where lymph drains from the face and the lungs goes to the right upper quadrant, then it is an issue. The thermography, because you can't say, well, my teeth don't hurt. And no, subclinical infection means that you can't feel it. And that's what cavitations are. And I've seen this in fibromyalgia, all sorts of autoimmune conditions, cancer. Okay, you're going to see all sorts of tumor growth with lines coming off of it. Dental toxicities are a big contributing factor. That generally, you cannot resolve a root canal by that. You can't resolve a cavitation. You can resolve cavities and gum regeneration. You can regenerate gums and you can regenerate the enamel. But if there is amalgam fillings, it's not, maybe these are going to cause a problem. It will. It is causing a problem. Like when we remove amalgams, there's a whole protocol. You can't just pull them out. I mean, we have a vitamin C IV, we have pure oxygen here. There's a special vacuum, a vent, because when we grind it down, there's vapors released and that vent sucks them in. And then there's a full rubber dam in the back of the throat to catch anything else. And we do 5 different impressions where we can see what the teeth look like, and then we remove it, then we do it to get the impression of what the cavity looks like, and then we do another, I mean, just, it's a pain in the butt, but to do it upright, yeah. And then we check the blood before the dental procedure, and if any heavy metal is leached in the blood, then we have to do a chelation to get the heavy metal out. And remember, I do a lot of work with like Parkinson's, MS, and autism, and the blood, when it's not healthy, you get an unhealthy brain function. So this is like ridiculously important, and it's crazy that they don't do this. Like I had a patient who had a tremor like this, okay, where you can notice it, and she had a little bit of trouble with walking, okay, little hand tremor, and she told me, she said, I only have enough money on this trip, because she flew from, I don't know, Europe or some other country, okay, or a clinic in Tijuana. I only have enough money this trip to either do the dental or the chiropractic. Do the dental. Because, I mean, if you're being poisoned and I'm doing the adjustment, you're not going to get the results. This is why we talk about physical, chemical, emotional stress. This is why we measure post x-rays. This is why we look at the blood all the time. So if you have something poisonous here, and this is why, I mean, over the next few months, we're going to have the actual clinic, know where it's going to be, but we're going to be doing thermographies at it. And then that way, it's crystal clear, man. Nope, it's not bothering you. Don't worry about it. Or yes, it is. It's got to be a priority. I don't know what the protocols here are for dentists. Yeah, in Europe, there's only a couple of rare things. Yeah, and even a lot of the people in California, they call them holistic dentistry. Yeah, you know, it's like corrective chiropractic. It's really, really hard to find. Yeah, if you got somebody that does a before and after X-ray, that's actual fact. How you feel? Yeah, I don't do that. Any other questions? So you can regenerate enamel, you can regenerate the gums, and if you got poisonous stuff in there, get rid of it. Kapun Kap, thank you very much.